Today on the 229 podcast.
Do you know what the physicians tell me? I am not worried about how many new patients you give me. I'm not worried about how many complex patients you give me. And I'm actually having some fun again.
My name is Bill Russell. I'm a former health system CIO and creator of This Week Health, where our mission is to transform healthcare one connection at a time. Welcome to the 229 podcast, where we continue the conversations happening at our events with the leaders who are shaping healthcare. Let's jump into today's conversation. All right, it's the 229 podcast, and today we are joined by Chris Paravate, CDIO of Northeast Georgia Health System. Chris, welcome to the show.
Thanks, Bill. Super excited to talk with you.
Well, when we started doing this podcast, one of the things we wanted to do is continue the conversations we're having at the 229 project. But yesterday you were on stage at Georgia HIMSS.
Yeah.
I wanted to, let's start with, what are you hearing? What are you seeing out there?
Yeah, I'm sure I'm not the first one to say that AI is not a fad. It's interesting for me to hear from other leaders about how that's taking shape in their organization. Governance is a big thing. I hear different strategies around speed and adoption. I hear different risk tolerances. So it's kind of, and then, a good colleague of mine, Jeff Brown, said there will be some aggregation, right? And I think that's a trend we've seen in other technologies. Well, I suspect we'll see it in this space as well. But I hadn't even thought about that, right? I've been so focused on, find a solution, make some transformation, demonstrate value, accelerate, right? And so I thought that was some sage wisdom.
Well, a Lifetime Achievement Award, love that for him. I'm going to dive into the topics you just mentioned. So we'll start with AI.
Okay.
Most people apologize for talking about AI. I'm gonna stop apologizing for talking about it. I think it's a real thing. You say it's not a fad, and I agree with you. The tension that we're hearing at the city tour dinners and the summits is between the ethereal and the real practical applications of AI. And and a lot of organizations are saying, look, we're trying to figure out how to sort of weed these out. They are worried about consolidation. Like, you go with some small player and all of a sudden they get acquired and now you're looking at something completely different. But how are we going to find those practical applications? Are we just going to wait for enough people to try them and be fast followers?
I'm such a no frills person, Bill, and I think you've kind of got to know me a little bit. So I don't grandstand on that stuff. I really do look for the very practical, and then I look for architecture and design, right? So, we're a big snowflake shop. We do a lot of stuff with snowflake tools. We look at architecture and we're saying, okay, well, if it's a small startup, what's their architecture, what's their design, and what's our ability to maybe even bring that in-house, right? But speed is a big deal. We weren't the first to adopt ambient voice recognition, but we've gotten in 2 months, we went to 80% adoption. 8 and 10 providers in our organization use ambient voice recognition now. And just hot off the presses, because we're chasing KPIs in a big way. Those physicians are seeing 2.75 more patients per week.
And we're not allowed to talk about that.
Why not? What's wrong with it? And you know what? The physicians like it and the patients like it.
I know. I agree with you. But it's an interesting thing. You can't bring it into the system and say you're going to see more patients.
I didn't ask a single person to see more, but you know what the physicians tell me? I am not worried about how many new patients you give me. I'm not worried about how many complex patients you give me. And I'm actually having some fun again.
Yeah.
And doing what I'm doing. And I'm doing it without the worrying about what is piling up, right? Think about, what our lives might be if we didn't worry about how many emails were going to be in our inbox, right? That's the parallel.
Right.
It's
Right.
like,
Yeah. No,
I'm in meetings all day. Guess what I'm going to do tonight?
we haven't really figured out email yet.
No, we haven't.
We come out of UGM and they're launching, another whatever number of AI features on top of the 100 and something they launched last year. And I don't see that slowing down. I think every year we're going to see a whole bunch of things added to the, let's just call it the chest of drawers over here that we can start opening up and implementing. What does it take to, go to UGM, sort of digest that, and then operationalize the ones that make the most sense for Northeast Georgia?
There is 160 use cases at UGM published from Epic on AI capabilities. And when you look at the rate of adoption, it's really low, really low. In fact, Northeast Georgia is pretty progressive in that adoption and not as deliberately pursuing that as I would like to. That was like an accidental
So,
benefit.
so do you take those use cases, bring them back, and there's a group that you sort of sit down and go, okay, let's go through these and
Working
see.
towards that. I mean, I'd love to tell you there's three things that are on my mind. One is, how am I differentiating those AI use cases from the rest of the work, right? So I just finished a call and we're looking at our HIS system and we have 320 enhancements in that list. 320. And that's, some people who listen to this and say, oh, that's nothing. Some people will be like, that's crazy. It doesn't really matter. Here's the thing is, I can't throw those AI solutions in that pool. They just get lost.
Right.
I
Yeah.
need to differentiate. And frankly, I'm working with Dr. Hanley, our CEO, to say, hey, how do we pull these things up? And I can say to you, hey, I can get you a $3 million reduction in costs in denial appeals letters in 6 months. Would you like that? Or would you like me to redesign the registration screen? And it's just, you're not in the same hunt, right? And these solutions can be implemented, frankly, in weeks, right? So, and for a decade, we've thought about implementations in terms of years or months or 6 months. We're talking about with some focused energy, right? Think about like COVID focused energy. You could turn up these things in a couple weeks and say, are you realizing value or not? I don't have that figured out, but I'm literally, and when I'm talking to whether it's Epic or Workday, I'm asking the question, can we do this in 2 weeks?
That would be really nice. At a recent city tour dinner, 229 city tour dinner, we were having a conversation and people are like, hey, nothing's changed. We have a set of problems that we need to fix. And if AI helps to solve those problems, we're going to do it. And you know what I do. I mean, I generally agree with that statement, but my job in those meetings is to push a little bit and say, okay, is there a different way to think about this? Because essentially we could just keep, okay, we have this set of problems and we have these tools and we're going to solve these problems with these tools. It depends how strategic those tools
It's
are.
magnitude though, right? I mean, if the AI solution compared to an enhancement request,
Right.
enhancement requests make 5 or 6 people happy. An AI solution allows those 5 or 6 people go do something different. The scale is far more transformational. And that's what I'm trying to bring that attention. And I'm trying to figure out how to harness that to go, the enhancements are good and projects are important, but I got this category over here that's like a really hot catalyst. And how do I maybe think about how we prioritize that work differently?
Yeah. I mean, one of the things I tried to do as a CIO, and I had a great conversation this week with a chief financial informatics officer, and it was a really good discussion. The
I
thing
know
I
that individual.
Yeah, you do know that individual. And she was talking about all the things that they target. And what I like to do as a CIO is to say, okay, what we need to do is, it's sad to say this, but money is the fuel that makes IT go. Money is the fuel that makes, gives us the ability to invest into
That's right.
new access methods and all sorts of other things. And so I would sort of align our resources around things that were going to get us a couple $1 million here and a couple $1 million there. And, if you can take denials from 5% to 2%, you just freed up a couple
Yep.
$1 million for the health system.
Yeah.
So, I mean, that work to me seemed, I mean, this is the application of AI to just solve the problems we have today is one way to go. The other way to go is to say, all right, these things could be transformational. I mean, you talk Snowflake, I mean, you have a lot of really good tools. If we elevate it even one step higher, is there a chance to fundamentally change the economics and the quality and the outcomes that are happening at the health system?
I think that the answer is both. And, I talked a little bit about this yesterday. At the center, we're still a people business,
Yeah.
right? And as a community health system, we take care of everyone, regardless of their economic status, their whatever. Caring for patients, just the medical care, the clinical care is complex, right? It's a dangerous business. But that's not all that comes in the door, right? What comes in the door is every family, disagreement, every economic, social situation that you could imagine. And so for those clinicians to be a little bit more in the moment and a little bit less distracted by the noise to care for that, that's at the core of our business. That is our tangible value. The durable value that Northeast Georgia brings to our community is the care that we deliver, right? So if I can reduce all that noise, whether it's denials or a keyboard, then I could be in that moment with that patient. I could have the energy to be with that patient. I don't think that those things have to be, there's nothing wrong with pressing that expense out of there, reducing that cost, because the truth of the matter is, you drive an hour north of here and it's very rural and it's very poor and those patients need care. And if we can care for them, in that community, then we're providing a better service, but two, we're not taxing a resource in other communities like here in Gainesville. So this is it, the equation is you can satisfy both. We can implement an AI tool that provides better care and reduce costs. That's not a sin.
I think the biggest buzzword since cloud computing right now is upskilling. I mean, the number of times I hear the word upskilling, what does that mean? I'm going to give you an interesting story to bounce off of. At one of our dinners, one of I think it was a CMIO, said they asked their IT organization. So they had the entire IT organization on a Zoom call or a Teams call, whatever it happened to be. And they said, how many of you have used a generative AI tool, have used ChatGPT, Claude, Grok, Gemini, whatever it happens to be, for work or for personal use? And the person said, I got just shy of 60% of the people in the room. He said that the only problem with that is this is IT and this represents less than the general public
Yeah.
in terms of use. And he goes, I was a little concerned, like, how are we going to upskill this workforce and what does it mean to upskill this workforce?
Two comments I have about that. One is that there is a younger generation that have just grown up with these tools, right? So I know a young individual who is working to sell ERP solutions. He's never implemented an ERP system. In fact, I don't even think he's even logged into an ERP system. But he can use one of those AI solutions to say, where is this customer? What are they implementing? What are the key considerations? What would be a strategy to address backfill or conversions? And he can start to assemble a roadmap to really help that customer think through that planning. For you and I, that was 10 years of experience, right? So there's this knowledge that this younger group is just going to leverage and use because it exists, right? And yeah, you see that in the consumer space, right? My daughter and her husband were sitting at the kitchen table the other day picking colors for their house, using ChatGPT. So I think that's one aspect. The other aspect is this, you recently published an article about AI adoption and how do you get to transformational, and you spoke a little bit about education. And I've been struggling with this thing called education. And you used the skill, upskill. And I'll talk about upskill in a minute. So yesterday I was driving to that event and I'm like, dang it, I still don't have a good answer. I still don't have, oh, here's how I'm going to upskill my team on AI. So I'm going to try this experiment. This is what I came up with at 6:30 in the morning driving to Duluth in traffic. Jeff Morrison is my chief analytics AI development guy. He's really pretty brilliant, but he is going to provide us a 15-minute education every week on a piece of capability. And I don't care where he sources it. He could source it from TikTok for all I care. But everybody's going to watch it every week. And I'm just going to start infiltrating this message of knowledge, because I mean, literally, we go to sleep tonight, we'll wake up tomorrow and there's something new. And so, one, that's a really low tech to really start to push that. On the more formal side of what does upskilling mean? I think it's really a fancy word for something us technologists have always thought about, which is how do I remain relevant and highly employable in a market, right? I mean, you know, I've been doing this for 32 years. I got some great VAX skills, Bill, and you want to hook me up, I can, C plus, and I can do anything on a VAX. But, for some reason, I decided that maybe I needed to learn something a little bit more contemporary and I need to broaden my skills. I think this is just another chapter of that, maybe on steroids, but we certainly have more resources to learn than we did 20 years ago.
It's going to be interesting. I'm going to keep delving into that topic as we move forward. And what does it look like to introduce the team to the tools
Well,
that
and I'll keep chewing at that because I'm not going to send somebody to get a master's in AI development. I don't need them to know development. I really need to know, how do I put these tools to work?
I was looking through the reason these are so relevant, so new. This feels like I'm hitting these things is I went through our notes for the 229 city tours today. Like Drex and I were sitting down. We were like, what were the top topics that were talked about? AI obviously was number one. Number two was money, as you would imagine. Number three is the one that surprises me. It's governance. And it's this whole idea of prioritization, governance and prioritization, and demand outstripping capacity. We talked about this a little bit earlier. I mean, how do you
Yeah.
stay in front of this?
It's a constant battle, right? So first of all, and I didn't appreciate this till I'd had some other conversations, and we were going through our digital most wired level 10 certification and really reflecting on our governance. Our governance right now is our C-suite. They are prioritizing our IT demand. And once upon a time, we used to get project requests and we'd kind of look at them and go, yeah, whatever, right? It's not a good request or it's not a priority. We get really good requests now. There's
I know.
no bad requests, right? It becomes what is the next most important thing for the organization. And you said the second thing that comes up is budget. It's like, well, what's really important for the organization and the budget they're not always congruent, right? And that's where the rub really comes down to is I could add 50, 60 FTEs to my IT team tomorrow, and we could maybe, increase our output by 20%. And I'm not sure that we would satisfy that demand. People would feel like it was 20% better. There would be more demand. And I wonder at some point, I've always worried about outstripping operations' ability to absorb all that change. That
Yeah.
used to be a really big thing in the top of my mind. It doesn't, I mean, we just keep cranking out more, and it doesn't seem that we've hit that, nursing, particularly when I worked in another hospital system, they would be like, stop, no more. Uh, I don't get that anymore. So I think demand will continue to be a focus. We've been very fortunate. We don't have a huge technical debt. I've been really deliberate over my 11 years of really managing that really progressively. We're moving all production systems to the cloud actually this weekend. That will avoid a big capital investment, but that's the thing. So here's the AI again, right? How do these three things play together? Well, if I can pull $4 million out of revenue cycle in waste, can I take 2 million of that and put it towards additional innovation? We haven't gotten that crisp yet. We got work to do.
In this time where there are financial pressures and we're wondering about Medicaid cuts and all
Yeah.
those kinds of things, what does the innovation budget look like? I mean, we used to talk in terms of placing bets. It feels to me like we don't place bets anymore. We only invest in really sure things at this point.
Well, I'm testing those edges, right? I'm looking at another piece of AI technology on our revenue cycle side, and it's not in budget and it's not planned, but I think it has a pretty strong ROI, and I'm putting that together. And frankly, I'm going to sit down with our CEO and our CFO and say, hey, do you want to place a bet? It's not in budget. but if we yield the outcome, it'll actually help the budget, right? It will drive more profitability. So, are you interested in that? And think about on the revenue cycle, and why is that so attractive? Let's say I save $1 million in revenue cycle. What does that represent in gross charges? I mean, it's got to be $5 or $6 million in gross charges, right? How many encounters is that? How many visits is that? So, talk about materially changing the bottom line. It's incredibly impactful. So I'll report back to you in about 3 months of what's our desire to place bets. I will tell you that our leadership, we're getting a lot of attention. I did a physician retreat just before UGM, our medical staff leadership retreat. I did a 2-hour presentation on AI. The physicians were on the edge of their seat. They wanted more, and I could have spent a whole day on it. And so a lot of people are really seeing the way that we could potentially make some big changes. And we're doing a lot of stuff on the medical. An example I didn't mention earlier, but we have a high propensity for lung cancer in Northeast Georgia, and it's not because there's a huge smoking population. So we've implemented an incidental findings module that, let's say, someone like you or I go and get a calcium CT score. Well, now I got a CT of your whole chest, and I can move it through an AI algorithm. And if there is a pulmonary finding, I can route you to the right person, and that intervention could be addressed probably and identified earlier and faster. And so we're seeing some big outcomes. I mean, that's the stuff the medical staff get really excited about.
Yeah, I can see that. This may not be the way we think anymore, but is there a technology out there that you're looking at and keeping an eye on because you feel like it's going to have a significant impact?
You know what I watch? I always watch the money. I mean, when you kind of pull back and you look at, some of the technology companies and where the dollars and the investments are being made, that often is the leading indicator for me of a technology that I need to watch. And there are some big bets being put out there right now. An early bet that we made over 2 years ago was on Snowflake, and that has, really paid strong dividends. That's one that we watched and quickly jumped on early, and that's been a strong platform for us as well.
We've had two mergers this week, two tech companies. So you had Press Ganey and
Yeah,
Qualtrics come together. You had HealthLink Advisors go with, who'd they go with? Anyway, they went with another
yeah,
Chartist, I think.
Chartist, yeah, right.
Is that something that you keep in the back of your mind? Like, will this company get acquired? And is that part of the buying calculus for you?
The short answer is yes, because we've seen so many acquisitions that, you know, products have been, several products have been aggregated, and then all of a sudden there's a change in leadership, a change in direction, and that product went from an up and coming leading to a bust, right? And so, I've been very intentional with the architecture here. We have 408 applications. So we're a $3 billion organization, 6 hospitals, 13,000 employees, 408 applications. So that's pretty dang good number, pretty low comparatively speaking. When I look at benchmarks, probably more like 600 to 800. And so we do pick partners very deliberately, and we look for platform strategies along the way. And then, I think there's transitional solutions out there that you may say, hey, you know what, that will buy me 2 years, and we'll see where the market matures, and I'll either get off that system and move to something else. And I think these are pretty durable strategies. I think a lot of CIOs are thinking about that. We have the benefit of being very centralized, and all technology. For example, all software is budgeted in IT for the entire system. It's all under our cost center. All the contracting is under our cost center. We manage that very deliberately so that we can get those legacy systems out.
I mean, a lot of people talk about that. It's like all the budget money's in IT. So when the organization wants to spend more money, there's really no transparency or accountability to them. And so you end up like, hey, we need to do this. Let's purchase more licenses and whatnot because it's not hitting their budget per se. Is that something you guys have gotten around?
Well, it's a balancing act, right? So you got to have it with governance, right? Part of our governance discussion, the C-suite is, hey, you want that piece of software, it's not in the budget, and here's what it's going to take to support it, and here's what the operational implication is. So when we go to budget season next year, the first $350, $2 million of any investment, any incremental investment we're going to make, you're taking that right off the top. And that gives some pause. And there's a little bit more peer accountability there to say, well, wait a second, do we really want to spend that here? What's the value? Is this something that's just keep the lights on, right? I mean, there's some things you've got to have. But I'll give you an example. We haven't deployed Microsoft Copilot. And you say, well, why haven't you? Well, it's an incremental cost to my licensing structure. And I can't quantify the ROI on rolling out Copilot to my user community. Now, lots of people want it, but I can't produce an ROI on that. And so the executive team has said, no, we're not going to roll out Copilot broadly. We'll use it in a very specific way. That's a tough decision, right? But that's kind of where we're at. Now I'll challenge, that I think will over time will become commoditized, right?
Yeah, that one comes up a fair amount when people are saying, who stands to gain the most from Copilot being rolled out across the health system? I mean, is it the email tools? Is it and what do they do without it? Like I go to Claude and ChatGPT about 5 times an hour. Do they have an alternative there?
I mean, yes, and that's the thing is you can use and Chat GPT, you can use Claude, you can use lots of others. You don't have the full integration, you don't have capturing meeting minutes. There's some things we're not going to allow you to do. But we're pretty liberal in access. So if I need a draft a job description, I'm going to go to one of those publicly available tools and source that or a policy or maybe even a thought process. So, and I think then you get into that same comment you made, which is, 6 and 10 are using a tool, and that's in IT. Well, I'm going to pay full price for a Copilot, and I'm going to get 40% utilization or 30% utilization. And what planet does that make sense?
Right. Right. Man, it's right there. It's just a little checkbox on your Microsoft.
Oh, it's so easy to add that to your EA.
It is.
And I'm sure I'll have lots of incentives.
They'll figure it out over time. It'll be interesting. Hey, Chris, it's always great to catch up with you. I'm looking forward to seeing you in a couple of weeks.
Excellent. Look forward to seeing you, Bill.
Thanks for listening to the 229 podcast. The best conversations don't end when the event does. They continue here with our community of healthcare leaders. Join us by subscribing at thisweekhealth.com/subscribe. If you have a conversation that's too good not to share, reach out. Also, check out our events on the 229project.com website. Share this episode with a peer. It's how we grow our network, increase our collective knowledge, and transform healthcare together. Thanks for listening. That's all for now.